studies have really shown that if you can get kids eating healthy under the age of 5, that's going to set a standard for their lifetime.
WIC has been shown to reduce chronic disease, which is just awesome.
I think the highlight of the WIC grant has been that it's helped us create partnerships with Head Starts, and through those partnerships we're not only distributing fresh produce that may have otherwise been waste and teaching families about fresh foods as well, but we're also taking kids out into the garden so that they can learn about how to grow their own produce.
To try to expand the ability of people to go to different places to get the healthy food. There is a big difficulty in people getting out to the grocery stores. It's a 60-mile trip, round trip, for people from the pueblos to go into town to get fresh fruits and vegetables. So we elected to work on making fresh fruits and vegetables available close to the community.
We can give them all the nutritional education, but if they don't have access to any of these foods, it's not helping anybody.
We had a group of community leaders. We came together sometimes at 7:30 in the morning to come up with the non-pharmaceutical prescription pad. We felt that there was a great need in the community. Instead of giving a patient a prescription for some drugs, that we can start with providing them information that will help them to make lifestyle changes instead of a pill. Because a lot of conditions can be treated initially with lifestyle changes.
Referrals to our local food pantries are actually one of the most common referrals. Our WIC nutrition educators coordinate, so it made a lot of sense for WIC to look at our local food pantries and actually increase the amount of healthy options that were available there. I think WIC is such an important program within the community that having them part of the coalition that oversees the Community Health Improvement Plan is significant and has actually elevated WIC's presence within the community.
Food insecurity is a real issue here, and access to healthy food, affordable food, is a real issue for a lot of the underserved populations in our community.
The dream and the hope for these programs is that we actually do make a difference. So we'd like to have this be sustainable. We needed the Community Partnerships for Healthy Mothers and Children grant in order to make any of these wonderful projects happen. We're hoping these things continue to blossom and grow, and that it will continue to work together to improve the health of our county.
Supporting WIC and supporting their breastfeeding initiatives is so important because this is the health of our women, the health of our children, and the health of our infants. The future of our nation literally relies on the health of our pediatric population. So if we can help infants get off to the right start with exclusive breastfeeding, then we are setting ourselves up for a successful and healthy future. So what's next is we have to empower our moms and our WIC moms to advocate for themselves and help transform the businesses they work at to be breastfeeding-friendly workplaces.
One of our goals was to normalize breastfeeding in our community.
One of the initiatives of the WIC project is for our moms to have a safe, private place to go when they want to breastfeed their babies, and we have set up our mobile stations at the flea market, at National Night Out, and at the county fairs. This enables them to have a place where they feel a lot more comfortable.
We've seen a great drastic increase in our breastfeeding friendly environment. That's why this work is important, because in order to build healthy communities, you have to have these community partnerships, you have to have these systems in place, and we have to be at the forefront of making these changes.
The benefits far outweigh the disadvantages of breastfeeding, and we just have to help mothers and fathers and grandmothers learn what those benefits are.
I was excited to hear that the grant had an initiative to open a breast milk bank depot in the community, because I felt that this paralleled directly with what I do as a pregnancy educator in the community.
We've seen an increase in moms starting breastfeeding, and we've seen an increase in moms' length of breastfeeding since we've initiated having the 5 CLCs on staff.
This grant work has really helped us in Wood County address some of our chronic disease issues, and especially with our WIC program, we've been able to connect with others in the community, and we can sustain this work because of the partnerships that we've made and, built it into our strategic planning and other areas that we want to focus on in the future so that we can expand upon the work that we started here and continue to grow.